My main concern when I see a patient is how do I get them back to their life? A lot of these patients come in debilitated with pain and they can't function the way they want to, and they've been living with this situation for years. My goal as a surgeon is to offer them something that no one else can to get them back to where they want to be. So I basically cover anything that involves degeneration of the spine and deformity of the spine. When patients first come to me, they can be suffering from debilitating spine issues, back pain, pain that affects their quality of life and inability to go to work, etc. Sometimes patients come to me after a car accident or trauma and they can't function or do the things that they love to do or spend time with their families. My goal is to offer them an individualized treatment plan that ranges from conservative to interventional to surgical options. Obviously, my goal is to provide care that best fits their condition, and I try my best to avoid surgery in all situations. However, sometimes surgery is required, and in those situations, we offer both minimally invasive and robotic approaches to spine surgery. Traditionally, spine surgery was considered to be very invasive, involving a large incision and a very extended downtime in terms of post-operative recovery. But as technology has advanced and robotics and minimally invasive procedures have come into the field, patients are now able to have a faster post-operative recovery, less blood loss, and have a more efficient experience in terms of surgery overall. Robotic spine surgery is really optimal for patients that have a significant deformity in their spine, deformity and anatomical differences that warrants a more precise approach and more precise instrumentation with screws and rods. So the robot really allows us to put in screws in the exact location where we want. So in the days before surgery, the surgeon can really preoperatively plan and figure out exactly what size screws and what size rods can be placed in the exact areas of the spine. At MedStar Health, we are really the pioneers of robotic surgery in the region. We're one of the few hospitals in the country that actually do robotic scoliosis surgery. So the robot here is used specifically for complex cases or deformity cases that require precision with our screw placement and instrumentation. With robotic surgery, we are really able to do the surgery in a less invasive way, with less muscle and soft tissue violation. It allows the patient to be in less pain post-operatively, it allows them to be more functional, and allows them to be more mobile with physical therapy. So not only are they in the hospital less, they're also able to move around faster, and they're in less pain. When I was in medical school, I knew I wanted to be a surgeon because I knew I wanted to offer something that I could do with my hands. I knew I wanted to provide a procedure or technique to patients that had no other option. And when I talk about function, I talk about athletes, young patients, older patients who want to get back to normal sport. They want to get back to holding their grandchildren. They want to get back to living a normal life with their family, walking around at the stores, walking outside at the park. My goal as a surgeon is to offer something that I've been trained in, but that can get my patients back to living a normal life.